Good afternoon, everyone, and welcome again to the Multicultural Media Online Forum here at New South Wales Health, hosted by the Multicultural Health Communication Service, Multicultural New South Wales, and Ministry of Health. Today, we'll have COVID updates from Minister for Multiculturalism, Natalie Ward. She's back this week. And of course, our Deputy Chief Health Officer, Dr. Marianne Gale. We'd like to begin first to acknowledge the traditional owners of the land on which we are all meeting today. We pay respects to elders past and present and emerging, and extend and respect to Aboriginal colleagues. We also acknowledge the elders from all multicultural communities represented on this online briefing. And as always, Dr. Gale and I will take our masks off for this session to ensure clarity of our messages. And also we'd like to please request if you can please keep your microphones on mute, and please put your questions and comments on the chat, and we'll get to them as soon as we can. So thank you very much again for joining us. We'll get Minister Ward to please give us an update and say hello. It's nice to see you again.
Hi there, Jess. Hi, everybody. Great to be with you again. I'm coming to you today from Parliament, so I hope you can hear me all right, and it's great to be with you all again. And really thank you for coming again to our weekly Multicultural Media Conference. It's really important, so thank you. I also, of course, acknowledge the traditional custodians of the land and pay my respects to elders past and present. For me, that's the Gadigal people, and I thank them. There's obviously been some fairly significant changes that have happened in our government since I last spoke with you, and I'd just like to start by paying tribute to Gladys Berejiklian and the fantastic work that she's done for our multicultural community as a living, breathing multicultural Premier who is such a wonderful story, a very good friend, and the most hardworking person I know during her time as Premier. So I just wanted to acknowledge that. She's been an exceptional leader, and she showed her strength and her determination, her courage under incredibly challenging circumstances as we faced this COVID pandemic through all of our lives. And I just wanted to acknowledge that. Of course, being the hard worker that she is, she expects us to get on with the job and roll our sleeves up and keep going. So that's exactly what we're going to do. And of course, we look to the future now with Premier Dominic Perrottet, who's well experienced and knows our government very well and has a very clear pathway forward, which is great. So we're rolling our sleeves up, we're getting on with the job, and as we navigate our pathways to that 80% vaccination, our COVID restrictions will begin to ease. And so we've spoken about the importance of our beautiful, diverse communities and our determination to get New South Wales back on its feet after our recent challenges. I walk alongside Premier Perrottet as we face this next chapter, and I'm delighted to do so. And I'll continue to strongly advocate for our fantastic multicultural communities as your Minister for Multiculturalism, and it's a great privilege to hold that role. And it's very important to me that those who have worked just so tirelessly behind the scenes during this pandemic feel valued and acknowledged and know how much we appreciate the incredible work that they have done. So that's why at the very first opportunity, once restrictions had lifted, I headed out on Monday morning to pay a visit to several community organisations who played such a vital role in helping others. I've said so many times on the screen that I was looking forward to the day where we could see each other and look each other in the eye, and I could see you face to face and say thank you. So I called it on Monday. I didn't call it Freedom Day. I called it my thank you day, my chance to say thank you to so many in the community who did so much and continue to. The first visit was to Addison Road Community Organisation, which feeds 8,000 people every week. 8,000 every single week, and it was just a delight and such a privilege to pack some hampers and speak to the organisers and the volunteers who do such wonderful work there. I think that's our bells ringing. I just have to check if I have to go to this division, so I might just pause there and put it on mute so the bells in Parliament don't annoy everybody. Jess, I might have to throw to Dr. Gale while I just quickly run down to this division and vote. My apologies, everybody. It's one of the professional hazards of being in Parliament. So excuse me for just a moment. I'll be back with you hopefully shortly.
Thank you, Minister Ward, and we'll see you later, and we'll see you soon enough. Thank you for that introduction. Dr. Gale, how are you today?
I'm very well. Thank you, Jess. And good afternoon, everybody. Nice to be here. Nice to see you all. So in terms of updates from me, clearly from New South Wales Health, we're really pleased to see the vaccination rates continue to increase across the state. And I really enjoy looking at the coverage map of the first dose and second dose coverage across the state, and to see, you know, a big chunks of our state with really, really high first dose and even second dose vaccination coverage, and that every time that that data is updated, we see that just getting better and better. So far in New South Wales, we've administered almost 11.2 million doses of vaccine, which is really a remarkable achievement to everybody involved. And that is our wonderful GPs, who have for many, many months since the beginning of the rollout have been a really important part of making vaccines available, to our pharmacies, who are playing a particularly important role, especially recently with the Moderna vaccine, and of course our New South Wales health hubs as well. And I know that many, many staff have been working incredibly hard over many months to make vaccines available. So, and of course, the thank yous wouldn't be complete without all those in our community who've come forward to get vaccinated, which is really terrific. And I encourage people to continue to do so. We now have 90.8% of people aged 16 and over having received a first dose, and 75.2% receiving both doses, which is really terrific. And we're seeing those coverage rates as well increase really quickly in our young people in the 12 to 15-year-old age group that have more recently become eligible. And that's really terrific to see, and really important as well as we prepare for kids to go back to school. In the 24 hours till 8 p.m. last night, we had 444 locally acquired cases of COVID-19 reported in New South Wales. And sadly, we reported the passing away of 4 people. We are concerned about the case numbers in some areas of Sydney and also in some of our regions. And we ask the residents of those areas to be particularly vigilant. And they are areas of Lakemba, Marylands, Hebersham, Punchbowl, Guildford, Condell Park and Plumpton. And in the regions, people who live in Cessnock, Walgett and South Grafton. So if you live in any of those areas, please do be extra vigilant, please get tested, and please book in for your vaccinations. We have a few special messages. One is to let people know that since we've ticked over to the 70% double dose, there are changes that we have been making to our contact tracing process. And now for close contacts who are fully vaccinated with 2 doses of a COVID-19 vaccine more than 2 weeks before they were last exposed, their isolation period is now reduced from 14 days now down to 7 days. So that's really good news. And for people who are fully vaccinated to know that if you do happen to come into contact with COVID and do happen to be a close contact, that requirement for isolation is now a shorter period. Another special message for families out there and for parents and children preparing to go back to school. It's really important that for any child that has symptoms of COVID, even if mild, a bit of a sore throat or a snuffly nose or a bit of a cough, it's really important to get tested from now until the lead up of when school goes back, and also once you're back at school. So if you get any symptoms, even the mildest of symptoms, very important not to go to school, very important to stay home, get tested and self-isolate until you receive a negative result. And that's particularly important to help us reduce the risk of transmission in our schools as we progressively open up. And finally, I'd just like to remind everybody again that there's lots of opportunities to get vaccinated, and including for people in our community who have already had COVID-19. We're advising people now that if you're fully recovered from COVID and you're feeling well again, you don't need to delay getting your vaccination. You can talk to your doctor if you're unsure, and it is possible that you can delay your vaccination for up to 6 months, but it's also advisable and it's safe to get vaccinated once you are feeling well and you have recovered from your COVID-19 illness. So I think I'll leave my questions there, my comments there rather. Thanks, Jess.
Thank you, Dr. Gale. We have a question from Wei Wang. We'll start off and just letting you know that Minister Ward will be back in a few moments. Wei Wang from SBS Mandarin program is asking, And she says, we might see the increasing daily new cases after the easing of restrictions. Due to the high vaccination rate, most cases could only have some mild symptoms. Has the government developed a plan to support the COVID-19 patients in home isolation? And are there enough nurses or social workers to tell them what to do and how to avoid home infections?
Thanks very much, Jess. Yes, certainly as we go forward and as restrictions ease, it may be that we do see more cases. And as you very rightly pointed out, it's our intention and our goal that even if we do see higher case numbers, that the vast majority of those illnesses will be mild. We do know that the vaccines are highly effective in preventing severe disease and preventing people in hospital and preventing people in ICU. And that's absolutely what we have seen here in New South Wales. And so even if case numbers increase, we are hopeful that the vast majority are going to be mild cases. And our health services across the state have very active programs of supporting people at home. And we're always looking at new ways to deliver that care. And a number of our clinical services take care of people using virtual means, including apps for people who are savvy with their smartphones and who are well enough to be able to manage that technology, and are happy to do so. We're also looking at ways to involve and work more closely with GPs in the care of people who have COVID in the community. So there's lots of options there. And as you have rightly pointed out, the vast majority of cases are going to be mild. And so we're looking at providing a flexible range of options for people that we can check in on them and make sure that they're doing well, but also have the ability to take care of those people, that small group of people who might become seriously unwell and need more intensive medical care, including potentially a stay in hospital.
Thank you, Dr. Gale. And Minister Ward, nice to see you back. We have a question for you here. Minister Ward, can you please provide an update?
Yeah, sorry, can you hear me? Yep, no problem.
Yes.
Thanks so much, Jess. Yeah, apologies, everybody. I did get the pair, so great to be back with you. And I might just quickly finish off if it's okay and then get to the question. Is that all right?
No problem, please.
Oh, wonderful. I just wanted to call out the wonderful, wonderful work that was done so that I could be able to thank those who were so wonderful in the visit that I was able to do on Monday. And as I said, in Addison Road, Rosanna Barbero and the volunteers there, including Craig Foster and Carly Kwong, they were amazing. They were all out there packing boxes, and we got to do that together, which was amazing. I then got to go to Lakemba to visit the Muslim Women Australia, which was so important to ensuring that Muslim women have had strong representation during COVID. And the beautiful Maha Abdo, her executive officer, and all her team there doing such wonderful work. So the opportunity to say thank you to them. They have not closed their doors the entire time, and they have not sent anyone away, which is just fantastic. I thank them. And also the Lebanese Muslim Association Vaccination Clinic. Amazing, next to Lakemba Mosque out there. It was incredible to hear that almost 10,000 doses have been administered there alone, and it was a huge effort. So I just want to say thank you to the LMA's General Manager, Khaled Alamadine, and the Vaccine Hub Project Manager, Ahmed Malas, and of course, Sydney Local Health District Chief Executive, Dr. Teresa Anderson. She's amazing, made it all happen, and everyone else out there in the team who worked so hard to get those jabs in there. So that's been a critical part of our response out there. And I just want to thank everybody for their hard work. And then finally, I got to go to the GWS Giants headquarters at Sydney Olympic Park, which was amazing, and meet the incredible team behind the Giant Hand food hamper project, including the GWS head of community, Ali Faraj, the famous Ali Faraj, and help pack some boxes out there as well. Beautiful food hampers. So I'm in awe of the great work done by everybody, including, of course, our translators and interpreters, some of whom I was able to meet. And it was just wonderful to thank them recently on the online forum on the 160 multicultural New South Wales translators and interpreters on International Translation Day. So thank you to them. Thank you to our wonderful multicultural community that ensures that more than 200 languages and dialects are translated and conveyed across New South Wales. So I'm just delighted that our vax rates are continuing to sprint towards that 80% mark. There's light at the end of the tunnel, and it's really exciting to see. And finally, I just want to talk about the Premier's Multicultural Communications Awards, which was to honour and recognise and thank all of you for the incredible work that you've done. And I was really pleased to be able to get those underway. Unfortunately, we can't hold the normal awards evening in person this year, but it does not take away from the outstanding achievements of all of those multicultural winners and finalists, each of you who joined together. So thank you. And I was really pleased to personally ring a number of the winners to thank them. We will have a recognition at the Premier's Harmony Dinner next year, so that will happen. Finally, my message from the Minister column will come out this to you. I think it's been sent to each of you, and it's a great way to keep your viewers and readers and listeners updated. So I just wanted to thank you all for your great work, and I'm happy to take that question now. Thank you so much, Jess.
Thank you, Minister Ward. The question is, could you please provide an update on the New South Wales Government's roadmap?
Yes, what a pleasure. Thank you for everyone's hard work. We're at 70%. So we know that with that milestone being reached, that we've eased a number of the restrictions. And thank you to Dr. Gale and all the health team that have worked so hard on making that able to be put in place. So of course, now fully vaccinated, double vaxxed adults can enjoy more freedoms since Monday. And the changes at 70%, of course, now allow up to 10 visitors, not counting children 12 and under, to a home. So it's up from 5. You can now have those outdoor gatherings up to 30 people, which is wonderful, and weddings and funerals now up to 100 people, up from 50, which is great. I was really pleased personally that we could have indoor pools open for swimming lessons and squad training and lap swimming, but also importantly for rehabilitation activities, which happen importantly in pools. Of course, on the Monday after we clear that 80% double vaccination rate, we will ease further restrictions, and hopefully that will happen sooner than we had anticipated. So people at that point, double vaxxed, will be able to have up to 20 visitors, excluding children under 12, to their home, and up to 50 people will be able to gather outdoors, up from 20. And up to 3,000 people will be allowed to attend controlled and ticketed events outdoors. Nightclubs will be allowed to reopen. They'll be allowed to have seated drinking, no dancing, and masks won't be required in office buildings, which is terrific. I'm not wearing my mask today because I'm in my own office, but we do have to wear them in the Parliament. So we know that those roadmap freedoms at 70 and 80%, they'll be continuing for people who are fully vaccinated, and we're very much looking forward to those. And thank you that we're there much earlier than we anticipated, because everyone's been doing such a great job. But if you haven't had that second dose, please go and get it as soon as you can.
Thank you so much, Minister Ward. Dr. Gale, it's a question here. I've had my first dose, but now we don't need to get vaccinated. I don't think I need to get my second jab. That's a question. Is that correct?
Thanks, Jess. No, that certainly would not be my advice. And well done for getting one dose. And I'd certainly be encouraging you to get that second dose and book in for that. We know that one dose of a vaccination is better than nothing. It does provide you with some protection against transmission, some protection against serious illness. But we know that 2 doses is much, much better. And so if you've had one dose, I really do encourage everybody to get that second dose. And it's really important, not just for you and your own health, but clearly that's a big reason, because none of us want to end up in hospital. None of us, even if we're fit and well, want to end up in ICU or lose our lives prematurely. None of us want that. And so the 2 doses is very important to protect yourself and your own health and well-being. It's also critically important for the people around you. And particularly if you're around children, we know that our young people under 12 years of age are not yet eligible for vaccination. And I think we all want to protect our young children. We want to protect our young people, make sure that they don't get COVID, make sure that they don't suffer any illness, even though it is very likely to be mild. But we know that serious illness can occur, and we know that people can have effects of COVID that last beyond their acute infection. And so it's very important that we protect the people around us. And the best way to do that is to be fully vaccinated, to protect your families, your friends who you come in contact with, people in your workplace. So I very much encourage you to go ahead and get that second dose as soon as you can.
Thank you so much, Dr. Gale. We have a question from Irie Sao from ABC, She said that temporary visa holders struggling to get proof of vaccination, we've been told by people in the Chinese community after they got their first jab, they realized they needed an individual health identifier, which then they got, but there's still problems with the record showing. Some have spent a couple of months trying to get it sorted, but it's something that's become more urgent with things reopening in New South Wales. What could you say about this, Minister Ward, and how can people obtain their proof of vaccination?
Yeah, it's an excellent question. Thank you, Jess. And we have gone to great lengths to ensure that everybody is able to get that jab. Everybody is eligible to get it, and that you should be able to get proof of that vaccination. So you can get your COVID-19 digital certificate or your immunisation history statement to show proof of your vaccinations. How you get that proof will depend on your situation. So it includes if you need to create a MyGov account and link those services or enrol in Medicare, you should be able to get that. And I know that I've done that online and you can get it that way. If you're 14 years or older, and I know this because I have 2 teenagers, you'll need to get your own digital certificate or immunisation history statement. You can either use your Medicare online account through MyGov. So you literally just go to MyGov and create that Medicare online account and you'll be able to get it there. I've done it. If you just persist and push through, you'll be able to get it there. There's also an app. There's the Express Plus Medicare mobile app, which my kids have because they prefer apps, and they've done it that way. So Express Plus Medicare app, or if you just go to your phone, you'll find if you put in Medicare, it will pop up. Once you've had your doses, both doses, you can add that COVID-19 digital certificate to your digital wallet. And if you want more information about that, just go to Services Australia. That website has everything there, and I believe there's phone numbers on there as well if you need that information. There's also, I think, translation services should be available as well. It will have instructions there to help with storing that proof on your device. And I know that those that don't have devices, you can also get a paper copy. You can get that printed out, and that's just as valid to have your printed copy as well. So yeah, Services Australia is the go-to place. Thanks, Jess.
Thank you. I think she also added that the message to get vaccinated ASAP as soon as possible is an important one. People on temporary visas or speak other languages weren't told what additional steps they would need to take in order, and especially if they're not eligible for a Medicare card. As Minister Ward, there's information for that.
That's exactly right. They don't have to be, there's no problem with being temporary visa holder, asylum seeker. We encourage them to get vaccinated. We will help you to do that, and we've shown that along the way, but there's arrangements for them to get that identification number there. So absolutely, don't worry if you're not enrolled for Medicare, that's absolutely fine. Just get that information through the My Services, MyGov website.
Thank you so much, Minister Ward. We have a question here that says that there's been changes with how, if I have had COVID, when should I get vaccinated?
Yeah, thanks very much, Jess. Essentially, once somebody has had COVID, we know that their body does retain some immunity to getting COVID again for a period of months after. We also know that vaccine-induced protection is also very good. And in the current moment, and the advice from the experts is also evolving both nationally and locally. But it's important at the moment for people who've had COVID, and once they've recovered from their acute illness and feel well, that they don't need to delay vaccination. You can wait up to 6 months, and we'd encourage people to talk to their doctor, their GP, about the best time for them to get vaccinated. But the basic message is, while you can wait up till 6 months, because you probably have some level of protection against getting another infection, you don't need to delay, and you can get vaccinated, and we'd encourage you to get vaccinated as soon as you have recovered from your acute illness of COVID-19 and you feel well again. You can go ahead and talk to your GP about organising vaccination.
Thank you so much, Dr. Gale. A question here from Hadil. They're wanting to ask Minister Ward for a question for an interview, so we'll direct that question to you directly from Iraqi TV. But one of the questions from Russell Anderson: with a potential increase in new cases and hospitalization, Will there be different messages developed over the coming weeks, messages and information about how to deal with home care or what to do with family members are in hospital? So we'll pass that on to Dr. Gale and maybe some comments from Minister Ward.
Yeah, thanks very much, Jess. Thank you for that question. And certainly, as I mentioned a bit earlier, we are expecting, as we have high vaccination rates in our population, and as I think you've heard us say before, we're very ambitious about how high our vaccination rates can go in New South Wales. And I think our population has shown so far that we're very willing and we embrace vaccination, and we really want to see those rates go higher. And with high rates of vaccination, we can expect that even if case numbers increase, that the vast majority of infections will be mild. So people with maybe like a flu or a cold symptoms, a bit of a sore throat, some headache, a runny nose. So that's what we could expect the situation to be, although time will tell, and we need to take baby steps in the future to work out what living with COVID is going to look like. But it does mean that there may be more people with mild disease being at home, as you would if you had a cold. And so we're looking at ways to continue to support people in their homes. We already have many of our services using apps, getting phone calls, doing video chats with health services to support people to be well at home. And we'll continue to look at all of those ways to make sure that people who are at low risk, and that's usually younger people who don't have other medical conditions and who have 2 doses of vaccine, are much more likely to have mild disease and are probably not going to need a lot of intervention and support from health professionals. So we'll certainly be looking at how we evolve our models of providing healthcare to people with COVID in the community in the months ahead.
Minister Ward, comments on that, and could these messages be in language?
Yes, oh my goodness, absolutely. So we've seen how that we're able to, based on health advice, be agile in this environment and how we can adapt. We've already adapted to rapid antigen testing. We've already adapted to all of the COVID safe requirements that we all know and live with every day. So yes, we will be well prepared for that. And based on the excellent health advice to date and going forward, we are preparing for all of those opportunities to be able to help people to do that self-care and also ensure that our hospitals are well equipped, ready, willing and able to look after everybody in the community. My job, as you rightly pointed out, Jess, is to make sure that we're getting that information out in language, and our wonderful translators and interpreters will be making sure that information is available as it evolves, as we've done to date with each of the changes and the public health orders as they've evolved. So I'm very much looking forward to that, and we'll be supporting our translators in multicultural communities and you, thankfully, the multicultural media, to get that information out as soon as it comes from health. So yeah, we will be ready and prepared to go. And again, thank you for the partnership of everybody out there in multicultural media to make sure we can get timely, accurate information in language out to all corners of our beautiful multicultural community.
Minister Ward, a question from Natalie Parish. People that have had COVID and recovered haven't been able to get the double dose and are unable to access business as they don't have a double dose certificate. How can they get around this? And if there's becoming a big issue in communities that have had large COVID numbers?
Thanks very much, Jess. Well, anybody who's had COVID can talk to their GP about getting a temporary medical contraindication form signed. And essentially that means that they can be exempt from requirements where that's required under a public health order, such as to get into a venue or a premises that require double dose. So if you go to your GP and you get that temporary medical contraindication form signed, that provides you with an exemption for up to 6 months. As I mentioned earlier, we're also advising that people, once you've had COVID and you're fully recovered, you can also get your vaccinations, and we'd encourage you to do so once you feel well again, to book in to get your vaccinations. So that's essentially the message, that anybody can talk to their GP about a temporary exemption for up to 6 months if you are recovered from COVID. But similarly, if you feel well and you're over the acute part of your illness, you can also go ahead and get your vaccinations.
Thank you, Dr. Gale. A question here: what should parents be considering for their children before school to keep them safe? I'll pass this on first to Minister Ward.
Oh, thank you so much, Jess. It's very exciting as a parent to be seeing our kids are going back to school, and they are so excited to go back as well. So for all those parents out there, thank you for the wonderful work you've done homeschooling so far, and wonderful to get our kids back in the environment where they can learn face to face. So of course, all students will now return to on-site learning with a range of those COVID-safe measures in place by October 25, with the second and third stages of the return to school plan now combined, because we've had such great vax rates. So bringing those forward. So kindergarten, year 1 and year 12 students will return to that face-to-face learning on 18 October. And for all the other years, they'll return 1 week later on the 25th. So so kinder, year 1, year 12 on the 18th, and everybody else on the 25th. To prepare for that, it is vital that we get those vaccinations into our kids, and there's lots available, so they can get those GP appointments or go to the Vax hubs and get there if they're over 12 to get those vaccinations, because they are the key to returning to normal and getting our kids back there reconnecting. We've done so much to get everybody vaccinated. So of course, residents 12 years and over have really led that charge. And we know that our Minister for Education and Early Childhood Learning, Sarah Mitchell, who's a mum of 2 young ones as well, says, she's absolutely clear that the schools are really ready to welcome those students back. They have been putting in place those plans to make sure that they are preparing for that return for students, and they've got detailed guidance with the principles and the checklist of everything that is needed there. So parents and carers will get detailed guides and more specific information from their own school, because it would depend on the school and the region that they're in. But if you haven't booked in for that COVID vaccine yet, please book an appointment as soon as possible.
Thank you, Minister Ward. And Dr. Gale, again, just a reminder, what are these COVID safe measures that we should be following at this time?
Yeah, thanks, Jess. I think it's a really important message as we take these steps in reopening, both in our schools, but broadly in the community, that while it's an exciting time, and I know people are really keen to get out there and take advantage of the newer freedoms and the relaxation of some of the restrictions, I do really encourage people and urge people to do so cautiously. It's still really important that you follow the advice that is associated with these next steps. Do so carefully, enjoy the time with your family and friends, but please do be safe and protect those around you. Please get vaccinated. Please continue to observe the physical distancing. Please continue to use your masks, and be aware that COVID is still around with us. People can still become unwell. We're looking at all of these measures to reduce the transmission, but do be careful, be cautious, and vaccination is the best thing that you can do to protect your own health and the health of those who love you and who you love.
Thank you so much, Dr. Gale. And that's it again for us for the Multicultural Media Online. So I'll pass this on to Minister Ward for final words.
Just once again to underline the great advice of Dr. Gale, and say to everybody, please get that second jab. We have done so well, and as we've traversed these weeks together, I just want to thank all of you in multicultural media and all of our beautiful communities out there who've worked so hard towards these stages. I can't believe we're finally here. It's wonderful. Please don't let your guard down. Make sure you're getting that second vaccination. Make sure your family and your friends are as well. And as Dr. Gale says, emerge cautiously so that we can enjoy this newfound freedom and all of these things safely, and we do so together. We've done the hard yards, we're running that marathon, we're just about to cross that final line, and I really appreciate the wonderful work of everybody, and thank you, Jess, for making sure that we come together each week to share in this journey and this important information.
Thank you, Minister Ward. Dr. Gale, any final words?
Oh, thanks very much, Jess. Look, really just to encourage people to have that conversation with the people around you about vaccination. And if you have friends who haven't got vaccinated or family members who don't want to, I think it's really important to have the conversation with them and engage with them, and try to have that discussion with them and understand what their hesitancy may be and encourage them to get vaccinated. And I think if all of us could do that as a community, I think that would be really valuable. We do want to see our vaccination rates be really, really high, and it's an exceptionally important measure for us as a community to go forward safely in living with COVID into the future. So that's probably all from me. Thanks, Jess.
Thank you, Dr. Gale, and thank you, Minister Ward, and thank you for joining us always here at the Multicultural Media Online Forum. It's important we hear your questions and that your questions can get answers from our New South Wales Health and Multicultural New South Wales. So thank you so much for joining us, for the time that you've given us and going on this journey with us. If you need the recording of this session, please go onto the New South Wales Multicultural Health Service website. Stay safe and take care.